So let me give you an example. I've been working on rabies control and prevention for a few years. Rabies, as you probably know, is a fatal disease once you develop symptoms. It kills about 60,000 people every year. And many low and middle income countries are endemic for rabies. Endemic means that the infection is maintained in the country without external inputs. So the WHO recommends vaccinating about 70% of dogs. So we've been working with several countries in rabies control for the past few years. And let me give you two examples of how evidence and data can strengthen policymaking. So the first is Mexico. Mexico was validated by the WHO as a rabies-free country in 2019. So there was mounting pressure to decrease funding for the annual dog rabies vaccination program in Mexico. So we worked very closely with the government to evaluate the program. The program started in 1990 and estimate how many lives it had saved and what was the cost effectiveness of maintaining the program running as it was. So that's an example of a successful program in preventing and controlling rabies, and why you need evidence to sort of decide to make a decision about maintaining the program. So Haiti is a whole different story. So the government in Haiti has many competing priorities in public health, and so it's hard for government officials to plan for many years. So a few years ago, we had a workshop to plan for mass vaccination campaigns to achieve 70% of vaccination of the dog population. So the problem was that even though dog vaccination is a very cost-effective program, the government did not have enough funding to pay for the program for such a long period of time. So together with CDC and the government in Haiti, we evaluated a plan that of integrated bite case management from the perspective of the government. So this is like a transition from not having a dog vaccination program to having a full-scale vaccination program. And the program had two components: active community bite investigation and passive animal rabies surveillance. So the program turned out to be very cost-effective, and it helped the government in Haiti start this program massively. It's been running since 2014. And it's sort of a transition towards dog vaccination. The government still plans to vaccinate 70% of their dogs. Nevertheless, they have taken this middle step to prevent many rabies deaths from happening as they get through to the last program. So this is two examples, very different examples of the same disease, and the decision that two governments made about a rabies control according to their available resources.
Now, economic evaluation is important because it enables comparison of the relative costs and consequences of different health intervention strategies. Now, in doing so, decision makers opt for the intervention which is more cost effective and have better impact. Now, for us, we have incorporated economic evaluation in the curriculum of fellows of the Advanced Field Epidemiology Training Program, which we famously call it the Uganda Public Health Fellowship Program. Now, a number of cost analysis projects have been implemented by the program. And I'll give you just one typical example of how that cost analysis helps in shaping up health interventions. There was a cholera outbreak. So we determined the cost of response of this waterborne cholera outbreak in a village in Uganda and compared it with the simple hypothetical intervention. So what we found was that the total cost incurred in investigating and controlling the cholera outbreak was $71,000 US. And this included, of course, personnel costs, which are person hours, compensation for the responders, allowances, medical equipment, and all that, and utilities. Now, we computed the direct cost of responding to the outbreak, which totaled 21,000 US dollars. Now, conversely, we compare this with constructing a deep well to provide cleaner water to the population. And we found that constructing a deep well would cost as low as 2,500 US dollars. So essentially the total cost incurred in this outbreak, which was 71,000 US dollars, would be enough to construct 28 deep wells. And the direct cost of responding to this outbreak would actually be enough to construct 8 deep wells, which would have prevented the outbreak from occurring and also averted future waterborne outbreak. So we made very clear recommendations to both Minister of Health and Minister of Water and Environment that a simple intervention like constructing a deep well would actually protect a bigger population than waiting for the outbreak to occur and then intervene, which would actually cost a lot of money. So this was a very glaring evidence which we presented to Minister of Health and to Minister of Water.
What I remember from the economic analysis modules is methods to model effect and determine cost effectiveness. As a civil servant, we always aspire for the best value for the money, especially given the very limited resources of government. I think if each and every policy and intervention by the government is backed by an economic evaluation analysis, wasteful spending will be alleviated. We can gain the trust of the public and the overall developmental targets will be reached.
Economic evaluations are a very important component because they show the cost or the resources that are required to implement the proposed policy option. And they also help give an indication or a projection of what the effects will be, in other words, or what the impacts will be. In this case, we're talking about what the health impacts will be. So as a decision maker, I'm working with very limited resources. And so it is more informative for me to know what it will take in terms of money and other resources to implement a particular policy option. Well, so without such an analysis, I might implement a policy option that may actually be effective, but fail to bring it to scale, 1. 2, also fail to make sure that it has impact. Because there is a minimum coverage of most of these interventions, especially health interventions, that you need to have in order to be able to have an impact. But you see, if I do not know how much it will cost, what resources I'll need, and how much of those resources I'll need, I will not be able to scale it to that level where it will have impact.